welcome back to Women's Wellness Radio, and we're also airing this on YouTube now. So if you'd like to see our guest today, Dr. Trevor Cates, you can head on over to our YouTube channel. And just a reminder that you can subscribe on YouTube, you can subscribe on iTunes, or however you listen. If you like the show, we'd love to hear about it, or you can share it with a friend. I think that most women are interested in today's topic, so we're talking about keeping your skin beautiful and glowing naturally with a true expert in the field, Dr. Trevor Cates. So welcome, Dr. Trevor.
Thank you. Thank you. It's great to be on your show.
Yeah, I'm looking forward to it. So I know that one of your sort of nicknames is the spa doctor. Tell us how that came about.
Well, I worked at several spas at Waldorf Astoria and a few other spas that I've consulted with. And so I kind of got to be known as the spa doctor. And with that, and I've been a naturopathic physician for 15 years. And so I've realized that even after stopped working at the spas, that there were so many things that people got from being in a spa, that relaxing environment, a little bit of pampering, relaxation, taking care of yourself. And so what I'm doing now is really helping people how to figure out how to take the spa home with them, how to, be their personal best without having to spend all their time in a spa. There's so much we can do to take care of ourselves so that we can have inner and outer beauty and health.
Okay, cool. Yeah, I was looking at your website. It looks like you still have a busy clinical practice and that you see children, adults. It looks like you treat all sorts of diseases, would you say?
Yeah, I see people of all ages and both women and men, but I would say the majority of people I see are women in their 30s, 40s, 50s, or most of the people that come in to see me.
Okay. So let's talk about the skin angle. How does our overall health and the look of our skin relate to each other?
Yeah, well, you know what, I find that the skin is such an important outer manifestation, sign of what's going on inside the body. So when we have problems like dry skin or problems like acne, rosacea, eczema, dermatitis, any of those kinds of problems or premature aging, it's a sign that something is out of balance within the body. And so when we restore our health from the inside out, we can have this radiant glow. And so it's a great way to look at our skin and say, okay, is it the best it can be? Maybe it's not. So then what can we do to help with that? And there's so many different aspects of that that can be really important on a nutritional level, on a hormone balance, our digestive health, so many different affect our skin, and a lot of people don't think about that. Most dermatologists don't talk about these things. So this is new for some people, and it's a different way of looking at our skin.
Yeah, so if somebody goes to a dermatologist with, let's just say acne, because that's a common one, what are they going to be told at the dermatologist or, given to do or take versus what you may have them do or take or test for?
Yeah, well, dermatologists, they really treat the symptoms. Most dermatologists, they look at the symptom and how they can suppress it, how they can get rid of it. And there are occasions when our skin is so inflamed that it is good to do something immediately that can reduce that inflammation. But the majority of times, the skin is just giving us a sign that something is out of balance. So we have these acne flare-ups, like you're saying, or could be eczema or any skin condition. It's a sign that something is going on. And so if you're just suppressing that symptom with what a dermatologist would prescribe, an antibiotic or a steroid cream to apply on the skin just to suppress the symptom. But if you do that and you're not addressing, that underlying cause, then you're not really getting to the problem. And with things like, especially with something like eczema, for example, when it's just suppressed, it ends up showing up in other ways and sometimes more complicated health problems. Like I've seen people with eczema and been to a dermatologist, it's been suppressed by topical creams and treatments. And then later on, they develop asthma or arthritis or other chronic inflammatory diseases that can be more challenging to treat. And so if, again, it's just finding a bit, that underlying cause. So when someone comes to see me with acne or eczema or any skin condition, I want to find out why that's happening. What are the triggers that are causing that? And this is a big thing with naturopathic medicine. As a naturopathic physician, this is important for us, is to find the underlying cause and address those underlying causes.
Okay, so I'm an acupuncturist, and sometimes clients will come to me and we'll be working on this or that, and they say, "Well, can you do anything about my acne, or can you do anything about my husband's eczema?" And sometimes what I say is, "I can, but you may not like what I'm about to tell you," and that it's not as simple as putting a cream on, or I can't just do a set of needles and suddenly you'll have clear skin for the rest of your life. So I'm wondering, first, when clients come to you, are they more ready and motivated to do that lifestyle type work? And if not, or if they're struggling with that, what do you do to kind of inspire them and help them get through those initial hurdles?
Yeah. Well, sometimes it can be simple. Sometimes it's just a matter of doing a simple change. And I've had people take out dairy out of their diet, for example, which may or may not seem simple to people, but just taking one thing out of your diet and then having clear skin can be
Mm,
certainly be worth it. So
okay.
sometimes it is simple. Sometimes it takes some time to figure out what's going on. Like for example, with acne, there are a few underlying causes that come to mind that I would often look at for people. One of them is, like I mentioned, dairy is a pro-inflammatory food. It's a common food allergen. So when people eat that or any other food that they might be reactive to, this is just the most common one, then it creates inner inflammation in the body, and that can show up in the skin. And so, if we identify foods that people are reactive to and remove those from the diet, at least temporarily for a period of time until the body has that ability to decrease inflammation, then you're going to have the clearer skin. And again, you're not going to have other chronic illness problems or symptoms show up as a result of that. Another big one is hormone imbalances. We know that, when people go through the teenage years. I have a 13-year-old daughter and a 16-year-old son. I know about the acne flare-ups, the change that come with hormone surges. So when we go through periods of change with our hormones, like during puberty or later in life when women are starting to go through perimenopausal changes, then we can have these acne flare-ups. So it's a matter of what we can do to balance our hormones. So it can be simple. It can be a matter of, okay, I've got people I've got a cleanse program I put people on, and within 3 days of starting the cleanse program, their skin's cleared up. So it can be simple, and it's just a matter of making, can be a matter of making a few dietary changes, taking a few supplements. Those can make huge changes in our skin, and it doesn't have to be complicated. It doesn't have to take weeks or months to see the changes. It can happen pretty quickly.
Okay, well, that's very encouraging. Right
Yeah.
on. So you worked at a spa. We're talking a lot about nutrition. Do you still encourage or promote some kind of more external topical treatments? What like take care of the skin from that angle?
Yeah, well, the big focus for me is healthy skin from within. And so, talking to people about how to decrease inflammation, like we've been talking about, with diet changes, with supplements that help decrease inflammation, things like I'm sure you're familiar with, like curcumin and bromelain and things like that help reduce inflammation in the body. As well as liver detox support to help metabolize hormones, especially when we're going through those hormonal changes. Things like that are really important. But yes, topically, things can be very helpful for the skin too. And the thing is that if you think about the number of skincare products that we apply each day, I mean, with women especially, and men do it too. Men put products on too, with shaving lotions and creams, aftershave, all these kinds of things, as well as deodorants. And with women, we put on a lot more product, with the makeups and all the different lotions and serums and toners and the list goes on lipsticks and mascaras and all the different personal care products we put on. A lot of these have harmful ingredients. So they actually contain endocrine disrupting chemicals, hormone disrupting chemicals. So here we are at a time in our lives, us women are, late 30s and forward, going through hormonal changes, and we're putting things on our skin to make us look younger and more beautiful, but we can actually be doing more harm than good. So we can
Mhm.
actually be disrupting our hormones even more. And then, teenage girls starting to wear makeup and caring more about their appearance and putting things on their skin, they're also at a delicate stage too, and they're putting on these products that are disrupting hormones. So it is really important to think about what we are putting on topically. And a lot of people think that if you're putting something on your skin, it just stays on your skin. It doesn't go into your body. So they think of it, they don't think of the same rules as what they would put in their mouth as they would put on their skin. But actually, we absorb a lot through our skin. I mean, if you think about how we use nicotine patches or hormone patches and creams, we expect those to penetrate the skin. And skincare products are designed, most of them are designed to penetrate the skin pretty readily. So that means that those, the things that we want to go into our skin, like if we have, say we have some, CoQ10 or vitamin C in our lotions that we want to go in our skin, well, there might be a lot of other hidden ingredients that you're not aware of that are also penetrating the skin and going to the bloodstream and creating disruption with the hormones.
Okay. Yeah, that's a good point. Yeah, I can tell you. I'm gonna hopefully get back on this train. But I go to a local spa and they use this awesome organic skincare product called Eminence. I don't know if you've heard of that one. And they got me using like one of those, rotating brushes and stuff. And yeah, like you said, I don't think the internal is the most important. But I definitely found like putting really high quality clean stuff on my face and just having this like professionally, recommended regime. It was pretty simple, but just getting some professional advice did help. So, but yeah, it made me a lot more careful to read labels and yeah, like when you go to the drugstore or the grocery store, a lot of the stuff is not very high quality. And yeah, I don't think people think it's literally perhaps disrupting my hormones and making everything worse.
Yeah, it is interesting. I think people are getting better about reading labels on food packaging, but it's also time for us to start reading labels on our skincare products. The problem is, though, even with reading labels, it's hard to know what's in skincare products because they're really not very well regulated in the United States. And it's certainly not like in the UK, it's much more regulated there. And there are a lot of ingredients that we have in our skincare products here in the United States that they would not allow
Ah,
in the UK. And then also the labeling is a lot of things don't have to be put on the label. Like for example, something like phthalates, which you may have talked to your audience about. Phthalates are often found in plastics, and they are hormone disrupting chemicals. And these are often in skincare products under fragrance. And so they don't
mm,
have to label, they don't have to put on the label phthalates, but it's they just have put fragrance, and you can put all kinds of things under fragrance. So that is one ingredient to look for in your skincare products. If there are fragrances added and they're not natural, if they're not essential oil based fragrances, then there could be a lot of harmful chemicals hidden under that.
okay, that's good advice. So I know, like, for example, the skincare line mentioned to you, the Eminence, it's not cheap, and not everyone's gonna. And even sometimes I'm like, oh, I can't afford that right now. There's a lot of things you can do on your own, though, right? With essential oils, just that you buy pure coconut oil, or do you have any fun kind of home favorites that you can do yourself?
Yeah, I've got so many, and I can certainly I'll send you some that you can share with your audience because I think it's nice to have some recipes that people can actually look and read and start, making some of your do it yourself masks and lotions and toners, and so I've got some of those, and I can definitely share them with you. But some of the simplest things are like a papaya. Using papaya and just scooping it out and making a mask with it.
Mm.
Another thing is depending upon your skin type, avocado mask. I wouldn't do it at the same time, but avocado mask would be another nice soothing thing. You could make chamomile tea, let it cool, and put it in a spritzer bottle and use that as a toner, just a
Mm.
spray on the face. Coconut oil or almond oil or avocado oil, those all really nice moisturizers for the skin, and of course they're all natural, and if you can eat it, it's probably going to be fine for your skin.
Yeah,
Right.
right on. So you said to what one thing to watch out for was the generic fragrances. Anything else that we could watch out for?
Yeah, we especially summertime, spring, summer, sunny days, we go into those thinking we need to start protecting our skin, so people start putting on a lot of sunscreens. And sunscreens are unfortunately loaded with endocrine disrupting chemicals, and here we are trying to do a good thing to protect our skin and protect our skin from sun damage and skin cancer, which I do think is important. But one of the most common ingredients is oxybenzone. That's one of the chemicals that's in most sunscreens, and that is an endocrine disrupting chemical, according to some of the research out there. So oxybenzone is one to look out for. There's so many though that are these chemicals that are in sunscreens, and a nice alternative to that is zinc oxide. And zinc oxide is, it creates more of a natural barrier, and it doesn't have those hormone disrupting effects. Now, a few things about zinc oxide is that you don't want to do nanoparticles, especially in things like powders, anything that you would breathe in, because if it's in these teeny little particles, those the mineral makeups, or zinc oxide, things like that, titanium dioxide, you can actually breathe those in, and they can get stuck in your lungs and not be
Mm.
good for you. So when you're using the mineral makeups or zinc oxide, or just make sure that they're not nanoparticles and they're not powders. It's better to stay away from those. But there is technology, even not using the nanotechnology, there is technology now that you can get zinc oxide without it being the pasty, like, remember how it used to be,
Yeah.
lifeguards would have like the lines on their faces from the zinc oxide. Well, the skincare companies, or some of them, are doing much better job at making them so they're not quite so pasty. I know that when I first tried slathering these on my kids, it was so hard to cover them up and protect them. I'm very fair, and all three of my kids are too. So, but now there are some options for having some zinc oxide based sunblocks that that go on well and still create that protection of, and we want like an SPF 15 or so. And these SPFs that are 50 and above, really, we don't really need to do those
Okay.
because they create a false sense of security. They don't really protect us that much more than like a 30 or 15 or a 30. So I wouldn't bother getting anything above like there's 50, 75. It's just marketing at that point.
Okay. And you live in a sunny place. You're in Utah, right?
Yes.
So what's your opinion on, I live in the Northwest, and I usually don't wear sunscreen in the winter because I feel like, I need a little vitamin D. Do you think it's important to just protect your skin year round just for like anti-aging, or do you think you can, get a little straight sun sometimes?
Well, I think with our face, the sun damage that can occur, it can happen pretty quickly, whether it's winter or summer or cloudy or sunny. We
Okay.
still can get the UVA or UVB rays depending upon the time of year, cloud cover, all of those things. We still can get the sun damage. So I think it's good to protect our face, especially, because it does accelerate aging, and this is the area that we get the most exposure. So, but we can, I do think it's good to not always cover up, because then we're not going to get the vitamin D, because we need that skin exposure to the sun to get vitamin D. And so it's a really good point you bring up, because we do need that. And usually tell people is to try and get out in the sun. Like just 10 minutes a few times a week is generally all we need. And if you get like, your arms, your legs, maybe your back, just different areas of the body to get some sun exposure. It doesn't have to be your face. Even
Right.
your scalp, you can still get some vitamin D from that. And the with the vitamin D exposure, it also depends upon your pigmentation. So someone like me, I'm very fair. I don't need as much sun exposure to get vitamin D. Whereas someone that has a lot of pigmentation, that's darker skinned, they're going to need more sun exposure to get the vitamin levels. So, and also depending where you live. I live in a very high altitude area. I'm closer to the sun, so that's and don't have as much cloud cover versus somewhere where you're lower down and have some cloud cover. You might need a little bit more sun exposure. So those are some things to take into
Okay.
consideration when it comes to vitamin D.
Yeah, that's helpful. And so maybe if you're going to be out for more than 20 minutes with a lot of face exposure, even on a cloudy day, you're going to know you're going to get some damage if you don't cover up,
Right.
perhaps. Okay.
Yeah.
And it was really interesting about the powdered zinc. I actually do have like a mineral powder that includes, I think, zinc because she said it's all mineral and she said that's some sun protection. So I'm going to have to ask, would you say are all the ones that come in some kind of makeup powdered form are the nanoparticles or it depends?
It depends.
Okay.
You have to look at the packaging and talk to or talk to whoever you bought it from and find out if it's made in nanoparticles,
Okay.
because it is a concern. We don't really know right now what kind of damage can occur from that exposure in the lungs. We know that with the lungs being exposed to such small particles, it just makes sense that it would be a tough one.
Okay. Yeah, that makes
Yeah.
a lot of sense. So, you've got this whole skin summit coming up. We're going to get some more tips out of you today, but I know that there's so much more coming up. What do you say? Do you have 35 speakers? Is that right?
Yeah, we have 35 speakers, and it's so the Glowing Skin Summit, and it's April 27th to May 4th. It's free and online. So wherever people are, they can tune in and check it out. GlowingSkinSummit.com. And when people register, they'll get information about how to access it once it goes live on April 27th. And each day of the week of April 27th, we'll be featuring 5 of the speakers, and people can access it. They have 24 hours to watch, listen, learn, and these speakers are amazing. I know that you know a lot of these people, but we've got celebrity nutritionists like JJ Virgin. We've got hormone experts like Dr. Anna Kabeka, Dr. Jen Landa, Dr. Isabella Wentz talking about thyroid, Dr. Alan Christensen talking about adrenals. We've got integrative dermatologists. We've got estheticians that talk about skincare ingredients, talk about some of the things that I've talked
Mm.
about today, and a lot more. We've got people talking about acne and eczema, aging, healthy aging strategies. And we've even got a doctor, Dr. Harry Adelson. He talks about stem cell therapies. So this is getting stem cells from your own body, your own stem cells, and how they can be used for skin treatment. So really cutting edge stuff on more natural and less invasive skin treatments. And the idea is, again, our skin is just this mirror of showing us what's going on internally with our health. So when we really take care of our body, we can have glowing skin. So that's why I'm covering all these different topics, from nutrition and exercise to hormone balance and stress management. We even have psychiatrists and psychologists, exercise specialists, and talking about cellulite. So there's
Ah.
just so much information. I can keep going on and on about our amazing experts, but I think you kind of get an idea from that. And then also when people register for this, they get my brand new ebook. I just wrote an ebook on glowing skin from within. So top nutrition tips and top foods to eat and foods to avoid. and 7 steps to take for glowing skin. So that's something that people get for free when they register, as well as two of the interviews, the ones with Dr. Josh Axe and Dr. Isabella Wentz. People get those early if when they register, or they get
Cool.
them as soon as so they can start watching these interviews right away. So it's I'm really excited
I
about this
can
summit.
tell. That's great. Yeah, I think that a lot of my clients, and sure yours as well, they're intelligent women and they're doing a lot of stuff in the world, and sometimes they almost don't want to admit that they are concerned about their skin or they're not happy about their skin. But I think really all of us are. None of us feel good going out in the world if we're having a rash or we're having a breakout, or we feel like we look older than we are. I can tell you I've been trying some DHEA therapy lately along with some other stuff, and it totally has made me break out, and I'm still kind of recovering, and it's not the end of the world, but it's still just like, I just was like, I can't do this treatment if it's going to make me break out. It's just not worth it. So I think it's important to just learn more, because like you said, there are so many internal factors, and then there's so many options too. Rather than just wander over the drugstore, why not really get educated, right, on your skin? It's an organ. What does it need? How can you support it, right?
Right, absolutely. It's our largest organ. Our skin is our largest organ. A lot of people don't think of it as an organ because they think of our, liver, kidneys as organs, but our skin is an organ. It's our largest organ, and so it interacts and part of this whole delicate balance with our body. So it is really important. And we also talk about in the summit about skin cancer because, and this is part of why I became interested in skin, is my father got skin cancer. I've got very fair Scottish, Irish, English blood in my family, and so we're all very prone to skin cancer. And so I know how important this is when people can get skin cancer, and if we don't take care of our skin, if and with my dad's case, unfortunately, his the dermatologist that removed the squamous cell cancer didn't get it all, and it metastasized to other parts of his body.
Mm.
Luckily, we were able to catch it early on enough, and it's been, I think, almost, it's been about 10 years now, almost actually more than 10 years now, and he doesn't have the cancer anymore. So he's completely healthy with doing naturopathic medicine. He had to have some surgery, but skin is really important. And with things like sun exposure and sun damage, as well as things in our environment that create problems with our skin as well as our overall health. And when we're applying these personal care products that we've been talking about, we absorb that in through the skin, and then it affects our entire body. And it's funny, like you talked about how we kind of deny that our skin is, it's like a vanity issue, and we don't really want to consider that as important, but it is. And I honestly, dermatology was my least favorite class in medical school. And because I just thought it was just overwhelming, then with all the slides, the pictures of all the various skin conditions that people could have. But I have realized over the years how important it is, and especially as a woman in my 40s and getting older, I realize it's something we need to take care of.
Yeah, I would say I had a little similar experience. They do facial rejuvenation acupuncture, and when I was younger, I was like, oh, I would never care about that. And now I'm 40. I'm like, well, maybe I would care about that.
Yeah.
And yeah, I mean, because it's not just a vanity thing. You want to look as good and youthful in a way as you feel. And I'm totally fine with developing some little lines and wrinkles, but at the same time, I hope that I will never look much older than I really am. So
Right.
just keeping that healthy glow for sure.
Yeah.
So do you want to give us some more either of your own tips or some things you learned from your various experts? You give us a little sneak peek.
Yeah, so and I also wanted to mention that one of our speakers is an acupuncturist. Shiroko is an acupuncturist, so she talks about acupuncture and how that can impact our skin, and the acupuncture facelift and how
Nice.
that works. So just, giving people a little bit about that. Well, there's so many things I about I guess there's certain nutrients that are really important for the skin. Things like omega-3s and antioxidants are really important. So people, for if you want to think about foods to eat for your skin, colorful fruits and vegetables, especially berries, are particularly good for counteracting oxidative damage that occurs from exposure to the sun and environmental toxins in our environment. Eating fruits and vegetables that are high in antioxidants help counteract that. Sometimes it's good to take a supplement too if you have a lot of exposure to these things and or genetic predisposition to not being able to handle the oxidative damage very well. Then supplements can be helpful. And the same thing with omega-3s. We can get them in our diet to a certain extent, but to really get the most anti-inflammatory effects of that, and it can be helpful to take fish oil supplement of high quality. And of course, I'm sure you talked about on your show the supplements and the there is a big difference in quality of various supplements. So whenever people take supplements, it's extremely important to look at where they're from, the raw materials, where they're from, how high quality these are, and the practices of the manufacturers that are making these. So that's one thing. Another thing to think about is your digestion, because so many skin problems come from inflammation or problems with digestion. And so we about digestion, if you may or may not have digestive symptoms, but certainly if you have digestive symptoms like gas, bloating, constipation, diarrhea, heartburn, any of those kinds of things, it's a sign that something could be a sign that's going on, something's going on with your digestive system. And we have this, gut microbiome that is this delicate balance of beneficial bacteria that are in our digestive tract. And when that gets out of balance, it can create a lot of problems within the body, and that can show up in the skin. So it's really important to do things like eating fermented foods and taking probiotics, especially if you have digestive symptoms, to help with that gut microbiome, to help with your digestive support. Also getting plenty of fiber to make sure that you're eliminating regularly, because if we get constipated too, that can cause things to back up, and that shows up on the skin. People with dry skin, with acne, those are some of the things I commonly see. If people are backed up, they're not, having regular bowel movements, certainly fiber is important for that, and getting and being well hydrated. Of course, drinking plenty of water. So those are all important. And in addition to the gut microbiome, we have a skin microbiome. Our skin has its own balance of bacteria on the skin, some beneficial, some harmful, but we want to, our body wants to keep that in check. So when we put skincare products on our face, some of those actually kill off the beneficial bacteria. Just like when you eat things that, or take antibiotics internally, that can kill off the beneficial bacteria. When you apply those to the skin, or if you're washing your hands with antimicrobial soap all the time, you're killing off the beneficial bacteria that are on the skin that are protecting it from things like acne and eczema. So definitely something to think about.
Interesting. So yeah, when trying to think about, so I know I would understand antimicrobial would kill off bacteria on the skin. What else? Just too harsh of cleansers would clean out the
Yeah, well,
bacteria?
so our skin has mildly acidic environment. So while a lot of, we talk about when, internally we want to take things in that kind of help keep our bodies alkaline. We want our skin to be mildly acidic. A lot of the skincare products that we put on are actually too alkaline. So then it affects that delicate pH of the skin, which then affects the skin microbiome and kills off some of those beneficial bacteria, or feeds the bad bacteria. So skin pH is a really important part of that. And skincare products, I'm realizing more and more how important those are. And I've realized this more doing the summit and interviewing the people that are on the summit, these experts educating me on all the different ingredients in our skincare products, and how they throw off the microbiome, the pH, and the nutrients in our skin. So these are big things to think about.
Yeah, that's really interesting. I hadn't thought much about the pH. I know definitely when I was a teenager and I used like really harsh stuff from like the drugstore, it's so over drying. I can't imagine what it was doing to my pH back then.
It's true, and yeah, pH is just one of the things, and like you said, dryness. So if something is drying, we also have these great oils on our skin that actually help with the aging. Really, like the oils on our skin, the sebum helps with the aging process, keeps our skin moist and keeps us from developing more of the fine lines and wrinkles. But it also, if we don't have the right balance of the with the pH and the bacteria, then that sebum can then lead to acne.
Mm.
So it's this interesting balance, and again, a lot of this starts from inside, and whether or not we're eating things or we're doing things internally that are creating inflammation and imbalances with the microbiome and things, then creating problems with the skin, and then also externally is also really important.
Yeah, this is some great tips. I'm looking forward to the summit starting just a couple weeks. If you catch this podcast, say someone finds this podcast later, can they still buy the summit after it's over, type of
Yeah,
thing?
people can still purchase the summit package, which will have the downloads for with all the speakers and the bonuses, the free gifts that people are giving away. So, yeah, people can still access it.
Okay, so if you listen to this podcast in a timely fashion, you were rewarded with being on time to the summit and getting all the free material. And if not, you can see Dr. Cates. You've got your own podcast. You want to share that?
Yeah, so I have a podcast called The Spa Doctor: Secrets to Smart, Sexy, and Strong. And people can access that on my website, which is drtrevorcates.com, drtrevorcates.com. And you can also get it on iTunes and YouTube.
Okay, great. So there's lots of free resources after the summit as well, and you've got a lot of great guests. I was just looking over your podcast the other day. I'm going to be a guest more soon. I think we did a recording recently, so yeah, love it. Love the sharing. Anything else you want to share before we close up with our audience?
Well, I really want to encourage people to check out the Glowing Skin Summit. It's glowingSkinSummit.com. Really great information, and it's not very often you get 35 of these amazing people, these amazing speakers, all in one place. You're not going to find them physically in one place, all speaking in an event, but doing it online and free. It's just something that people shouldn't miss out on.
Yeah, right on. Yeah, we will share the links on all the show notes and stuff so people can easily find us, and you can find it on our blog too, which is bridgetdanner.com. So thanks a lot,
Thanks.
Dr. Cates. It was a lot of fun.
Yeah, thanks.
Bye. And to everybody else,
Bye.
we'll see you next week. This is Bridget Danner from Women's Wellness Radio. Bye-bye.